I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I have the pleasure and the honor to be with you to to have a one-to-one chat, a conversation about very important issues, health issues. I'm a doctor. I have been a doctor for over 50 years, and I have dealt with a lot of medical challenges throughout my life, and I have seen how many people are suffering of terrible diseases, a lot of suffering and pain and expense of something that could have been prevented or handled in a different way. And every time I see this, and I have said this many times, I always think, what if I had had the chance to talk to you 10 years before the problem, 1 year before the problem? Would the story be exactly the same, or could have we made any difference in trying to help this situation to be more tolerable, to be with a better outcome, to solve the problem in one word? And what I see as one of the big problems of our time is that we have a body that responds very nicely to every demand. Everything we ask our bodies to do, our body will deliver. We want to run, we want to play, we want to dance, we want to sleep, we want to, have fun or work. Our bodies can deliver everything that we want our bodies to do. And probably one of the big problems is that our bodies at the same time mend and heal and solve problems as the life goes on. In other words, if there's any problem in any organ or in any tissue or in any part of the body will start healing it and mending it and patching it and solving one way or the other the problem. Instead of ringing a bell and telling us, hey, you're doing this wrong, this is happening to your body. So the lack of warnings, not that they're not there, but they're so subtle, they're so quiet that it takes a long time for us to realize that something is going wrong. So that capacity of our bodies to mend and heal is, of course, a huge advantage, but on the other hand, sometimes works against us because it doesn't allow us to realize that something is happening. And because of that, particularly when you were young, we tend to have the feeling that we have this body of ours with an unlimited capacity. Nothing can go wrong. Everything is going to function according to the way I want it. And we all have been young, and we all remember the days when we party and have fun and travel and walk and climb mountains and do a lot of things, and our bodies always are good responders. They deliver what we want. And we think, oh, I'm unbeatable. I'm very strong. Nothing can go wrong in my body because I'm doing everything very well. And because of that, we fail to see something that is exactly what I want to tell you today. Our bodies need attention and care. As anything else we have, as any machine we have, as our cars, our aircraft, or you name it, everything has the need of care, the need of maintenance, the need of watching what can go wrong. And the other big important concept is that you do not have to be sick to look for medical care. We have this paradigm that you go to the doctor when your health fails. And we never see that before this health failure, a lot of things started to tell us that things were not working very well. I have seen, for example, many movies or documentaries about aircraft accidents. And they tell you about little failures, little things, little gadgets within the aircraft that were failing, but were creating a little bit of a problem or shake or noise that nobody paid attention to. But one day, that little thing produced a failure that made the aircraft unworthy of flying. And then it just drops from the sky, killing a lot of people. And I have seen it with a lot of bodies. I have seen it with a lot of people. When you talk to them, when you start a conversation, then you think that, yes, there were some little rattles and noises and shakes and things that, had we paid attention, we could have corrected very easily. And because we didn't, the problem progressed and progressed and progressed, and many times it produces a domino effect because every organ in the body is connected. Our hearts depend from our heart. Our kidneys depend from our heart. Our heart depends on the lungs. The lungs depend on the blood supply. The blood supply depends on the liver function. And everything is handled and managed by the brain and the nervous system and the gastrointestinal tract, which is going to produce the supplies and the energy and the building materials to create a healthy body, etc. So everything is interconnected, which means that everything can have a domino effect. If you have a kidney failure, it's going to affect your heart, your lungs, your liver, your brain. If you have a liver problem, it's going to affect your lungs, your heart, your kidneys, your brain. You see? So we cannot let that happen, because one failure will mean many, many failures. And our bodies, with this resistance and resilience it has, it can bounce back from a lot of problems. We have seen it just with COVID-19. How many people were sick and they bounced back? Many of them to health, many of them to long COVID, but that's a different story that we have a blog, we have a podcast about it. But nevertheless, our bodies can heal and come back just to go on with the daily functions. But we have to pay attention, because if we do, we're going to be a lot healthier. Think of your body as you think of your car. Think of your body as you think of your garden. Think of your body as you think of anything you cherish and that you want to preserve, and make sure that it'll continue to deliver everything it can deliver to you. And the only way is by paying attention and by understanding that the capacity that the human body has to heal and respond to challenges in many ways, many times block the possibility of realizing that something is going wrong, that something is happening. And stop thinking, please stop thinking that I don't have to worry about anything, because after all, if anything goes wrong, I can go to the doctor and the doctor is going to write a prescription and the prescription is going to fix everything. If we keep on thinking in that direction, we're putting ourselves to the brink. We're going to look for medical attention when medical attention is going to be more difficult, more expensive, and with less capacity to solve the problem. I have said it many times. I have said it here in this blog. I have said it in this podcast. the later we try to fix a problem, the more difficult, the less successful, the more expensive it is going to be, like anything else. If you listen to a noise as your car rolls, and you keep on moving, well, very soon you're going to have it flat, and then you're destroying the tire, and that's going to destroy the rim, and that's going to damage the brake system, and that's going to damage the axle, and go on and on and on. So something that was a tiny little thing where you should have stopped and changed the tire and go on with your life turns into a very expensive problem. Why? Because we didn't stop to be careful and watchful and say, something here is happening. And no, a prescription will not necessarily solve the problem. It does in many cases. But the more you get involved in your self-care, the better off you're going to be. So we're going to be talking about something that I call BioCare with BioCare. BioCare means biological care. BioCare means that we're going to be proactive. We're going to be very efficient in overlooking our body's condition. And we say bio because we're alive. Bio in Greek means alive. So I'm caring for my body, for my live body. And with BioCare, because that's the name of our institution that is centered in the care of every function of the body, in the prevention of problems, in the working in an integrative, complementary way to help the body from every direction to work, to function, to heal, and to give no problems, just as you do with your car. If you are careful with it, you will never have problems, and you will have years of enjoyment. So please listen to the following parts, because we're going to be further and further discussing how deep this can get. Don't go anywhere. Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. That's who I am. That's who you are with. And we're talking today about BioCare with BioCare. Biological care of our bodies with a protocol, with a concept that we have called BioCare. And we have called it that way because I have always been thinking in how you approach the overall, the wholesome care of a human body. And I said that there's only one way. It's by BioCaring every step of the way, because that is a very inclusive concept where you're going to worry about every aspect of that life that you're caring for. You care about their nutrition, their supplementation, their well-being, their sleep, their rest, their activity, their feelings, their spiritual life, their mental well-being, and all these things. We are one very complex, very multifaceted person, but we're only one. And that whole thing means we are alive. In Greek, life is bio, B-I-O. So BioCaring means that we're going to be taking care of this fantastic human body that we have been entrusted to take care of. And that should be the first thing. We have been given this body to care for it, not to use it and abuse it. We were entrusted the body to make sure we honor our body, we worship our bodies, we take care of our bodies, and we make sure that everything with our bodies works well. Because in the practical point of view, it's very important, because our bodies, after all, are the ones that produce the money, that produce the well-being, that produce the activity, that produce everything we can give and receive from our fellow human beings. So if we are very careful with our body, we have years and years and years of profiting of everything our body can deliver. But to do that, we have to be proactive. We have to be conscientious that our bodies need attention. We have to be conscientious that it is us, ourselves, the first and foremost responsible for our body's well-being. It's not a doctor, it's not the Social Security, it's not the hospital, it is us. Because after all, we are the first line of defense of our bodies. We are with us every single day. We are with us every single minute of the day. So if we're careful, we're going to be watching what's going to happen with the body. And I'm going to give you a concept that I have used repeatedly that comes from the United States defense system. I remember when the US government announced that they had developed a system called AWACS, AWACS, that stood for Airborne Warning and Control Center. And they described what they did. Actually, NATO called it ice in the sky. What is this? This is an aircraft that overflies the world with a very sophisticated radar system just to watch, just to see what's happened. Not that we're at war, not that we are waiting for something to happen, just because we have to have a surveillance system that shows me as soon as possible if anything happens. Well, I think we should develop that for our bodies. We should have an early warning defense system. And what does that mean? That means that I don't have to wait to be sick. The same way they're not waiting to be at war to do it. No, you do it so war doesn't happen. You get the surveillance system on your health because you don't want your health to fail in the first place. So you're going to develop a system to watch that everything works well. And for that, you're going to check your weight, check your sugar level, look at the mirror, see how you look, check your body mass index. All these things are so easy to do that you could do them in 10 minutes once a month. And that you start building your record. Today we have computers. You can put it in your record, and 10 years from now you're going to see everything that has happened to your body. You can take one selfie, let's say once a month, once every 6 months, and look at you and see how you are developing into an older person. Do you look healthy? Do you look in good shape? Or aging starts to show heavy marks because you're not taking care of your body? All those things are so simple to do. And then, and here is where BioCare Hospital is on your side. And then you have to create a better understanding of how you can take care of your body, how you can prevent disease, and how you can manage a problem if it ever arises. And let me tell you, the more dedicated you are to biocaring your body, the less you're going to need to find answers, because nothing is going to go wrong. Your body is going to last longer time. So you need a certain degree of commitment and dedication that has to be once a month. I told you, 10 minutes, 15 minutes. Check my weight, check my blood pressure, check my sugar level, check my body mass index. It's so easy to do. You don't need money, you don't need go to a hospital, you can do it yourself. And that's the beginning of your early warning surveillance system. You can tell if something is going wrong. If my body mass index is going up, watch it. Do I have diabetes or worse, Alzheimer's in the horizon? I have high blood pressure. I'm going to have a stroke. I have to correct all those things. And then I have BioCare Hospital. And I can send an email. I can call. I can do things. I will advise you to do an email. And let me tell you why. Because you're going to keep a record of your conversation. This is going to be free. Doctor, my body mass index has increased in this number to this number in this length of time. Any ideas, any suggestions? We're going to be on your side. We're going to be helping you. I want you as a friend, not as a patient. And I know that you're going to be able to develop a much better care system. And that care system also, of course, includes some knowledge. You have to be developing the skills to take care of your body. And those skills include what you eat, your exercise, your sleep time, your lack of toxins like tobacco and so on. So you start developing a good skill. But the most important part is that now you are getting prepared. And I read this also about the aviation industry. They say proficiency is getting the capacity, but preparedness is unshakable. Which means if you learn how to take care of your body, if you start doing it, if you take good care of your body, that's great. But if you're prepared to face any challenge, that's unshakable. Because you know how, and you're ready for whatever life brings you. But believe me, if you start putting all the dots together, if you start doing everything I'm telling you, and again, we are your friends at BioCare Hospital. Send a mail. I'd like to start this. I'd like to open a health savings account. We have a podcast about what is a health saving account. Put every little bit of health, extra health you have, into a savings account to face other challenges. But if you start putting all these together, you're getting prepared to face the challenges. And that, again, is unshakable, and probably you will not even need it. Because that's the idea behind AWACS. If I have a very good surveillance, if I know something is trying to do this or something is happening here, and I can change it, if I can correct it because it becomes a crisis, we will never get aware of any big problem because we were watching, we were watchful, and we were prepared. So think of that. Think of all the wonderful things you can do to BioCare yourself with BioCare. We are in the social media of your choice. You can send any sort of message. And again, I propose an email because you can keep a better record of dates, times, what advices you were given, etc. And you can discuss it with your doctor, with your own doctor, and make him part of your health team. But remember that you're at the helm. You're the most important person in your health team. If you do, you're going to be rewarded. You're going to profit with great health. Let's go to the next step. Stay with me. Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, talking about BioCare with BioCare. Talking about the care we have to give to our body for our bodies to continue a long life and delivering the performance that we need. Second, we have been talking about early warning, surveillance, proficiency, preparedness. In other words, what we have to do with our bodies to be ready to face health challenges and just glide through them without being affected. Responding very well, healing very well. Be resilient to any sort of problem that we might have. But many of you might tell me, which is also very common, Doctor, I'm so many years old. I wish I would have started early, but right now I have this little problem, I have this other problem. Things are not perfect with me at this point in time, but I'm not really sick. Because that's the other paradigm that we have to break. I have to be sick to go to the doctor. I have to be sick to go to a hospital. I don't share that point of view. If I feel that my body needs extra attention, if I feel my body needs extra care, if I need to kickstart, so to speak, a really good health program, I might have to go to a hospital. And not a hospital in the sense that we have. That's something that I told you, we have to break that paradigm. I have to go to a place that we can call it a wellness center, where I'm going to be thoroughly diagnosed. Because yes, I have been doing my sugar level with my finger, I have been checking my blood pressure myself, etc., etc., etc. And I have some worries about this, about that. I have tried to make some changes. But let's face it, many times making important changes is not easy at all. If it were, we all would be doing it without any problem. But we all have problems to really comply with everything we have to do. And sometimes we start going out of line from where we would like to be, or the wear and tear of years start making a dent in how we function, in how we are. And then you have a new concept. We have talked about health savings account. I'm going to talk now about your owner's manual. We were given a body, but we never were told how to take care of it. People used to be very intuitive. If you go 100 years ago, if you go 200 years ago, because people didn't have medical care, they had to be extra careful. And they were very intuitive about what to do and what not to do. But we don't enjoy that capacity anymore. I wish we did, but we don't. We eat what pleases us. We party all night long. We smoke, we drink, we do a lot of things that are not really pro-life, are really not an advantage or an asset to our healthcare. So why don't you take a break and go to BioCare Hospital and Wellness Center for small, limited time? Why don't you have a BioCare Health getaway? Think of it. We work, we do a lot of things with our lives. We have to meet deadlines. We have to go nights without sleeping because we have to finish a report. Then we have to travel because we have to meet a client, etc. And everything is bringing down our energy and we don't feel good. What do we do? You say it. We say it all the time. I need a vacation. What is vacation? A vacation is a break from it all. I want to break from it all. I want to go away. I'm going to go to the beach. I'm going to go to the mountain. I want to go fishing. I want to put my mind at ease and do something different for a small period of time. And that's going to make me reset everything within my brain, within my body. And I know I'm going to feel better and I'm going to come back with renewed energy. What if that vacation happens at BioCare Hospital and Wellness Center? You're going to be thoroughly tested, not only for the problems you have, but for problems you might have in the future. Because not only we're going to check your sugar, but we're going to see what your sugar balance has been over a period of time. We're going to check for tumor markers. We're going to look for the possibility of a cancer beginning in your body. We're going to do some imaging studies to make sure that everything is fine. We're going to look after your liver's function because fatty liver is one of the most common problems in today's adults in the United States. And we can beat it. We can change all that. So let's find about it. Let's see how your immune system works. Let's see how your nutrition is. Let's see if you have any specific deficiencies. Because at this BioCare vacation time, we can selectively target the elements that we need to replace or to fulfill. So all these things can happen in a small period of time, 1 week to 2 weeks. So instead of going on a cruise ship, why don't you go to BioCare Hospital and Wellness Center? All this thorough testing is going to also take you to a number of corrective possibilities. It is a hospital. It is a full hospital. We can do intravenous nutrition. We can do intravenous targeted supplementation. We can do intestinal flora replacement, because one of the biggest problems in today's American environment is poor flora development, because the way we eat and the things we eat. So let's bring it all together. Let's bring it back. Simple example, magnesium. Magnesium is the biggest mineral deficiency in America. And it can be replaced in a couple of days if you do intravenously. But you need a hospital for that. And we are a full hospital with an alternative medical heart. We have all the skills of a medical facility, but we have the compassion and the feeling for integrative complementary medicine. So we work with the whole body. We fix everything we can in the whole body before it becomes a problem. So If I'm thinking I need a break, why don't you do a health getaway at BioCare? Instead of jumping on a cruise ship where you know you're not going to be, you might love it, but you're going to gain weight, you're going to eat bad foods, you're going to overdo things that exactly works against the direction you want to go. And I don't say you have to do it every now and then. What I'm saying is you could do it every so often according to your health maintenance program. And of course, if I'm turning 50, that is the ideal time. That's why I call it the 50,000 mile checkup. If I'm turning 50 or I'm around that age, that is the time where I have to review everything I have, to review all my assets and to review all my failures and see where I can strengthen things or where I can be very proud of how my body is working. And by putting all those things together, I can go back to work feeling relaxed, better, looking better. I always tell my patients, don't take it from me. Take it from the people you work with. Take it for the people your neighbors when they tell you, what did you do? You look younger, you look better. And in today's environment, I many times ask my patients to take a selfie every day when they're in the hospital. And you're going to see how your complexion, how the bags in the eyes improve. And I have had people that went back. I have a lady that told me, my daughter was looking all over the back of my neck because she told me, Mom, you did something. This is not just because of BioCare. You did some cosmetic surgery. I'm looking for the scars. Of course, she could never find them. And the more you do it, the better off you're going to be. And now I can tell you that I'm very proud to see people coming back every 2 years, every 3 years, to do a BioCare health getaway. Why? Because they have been enjoying the benefits. I have a couple, for example, whose wedding anniversary gift is a week of BioCare. And they love it, their children love it, because they have a healthy father and mother. That's what we have to do. Start investing. Start looking at your body as the best investment you can have. Because it is your body that produces everything. Your body is your biggest asset. Well, keep investing on your body from any perspective, from your attention, from your dedication, for your commitment, from your expenditure, good food, good everything. Your body is going to pay you with great dividends. We still have more things to tell you. So please stay with me. Thank you for being with me. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I've been talking about BioCare with BioCare. How to keep your life, your energy, your body in good shape with BioCare. And that means with BioCare's advice, with BioCare's support, and with BioCare health getaway vacation time. In other words, BioCare is going to be with you from the friendship and advice, friendly advice, to the management of preventive and proactive measurements to conserve and to improve your health. But many of you might already have a more important problem. You might have any sort of chronic degenerative disease that has already affected your life. Cancer is a frequent one. I wish we knew where it's coming from, because we could do a lot of things, but we don't. I can tell you that everything that I have said in this podcast will improve your chances of not getting cancer, because it is a disease that's very related to the inflammatory environment in the body. And when you talk about BioCare, when you talk about good health, when you talk about exercise and good food and good intestinal flora and rest and relaxation and lack of stress, all those things, all of them are anti-inflammatory. So if you start putting your life together, as I have been proposing you, if you even take the time and the effort to have a 1 week, 10-day, 2-week BioCare Health Getaway and be evaluated and everything, your chances of getting a malignancy are going to go down. But some of you might already have a health problem. And you turn and you wonder what you're going to do or what are your options. And then I tell you, BioCare continues to be a good way to go. Why? Because we are a full medical institution. We are manned and managed by medical doctors, by registered nurses, by top professional medical care team that's going to watch everything from surgical procedures to cancer therapy, to good diet, to detoxification, to intestinal flora replacement. You're going to be under a whole umbrella of protective, proactive care to help you to regain your health. BioCare environment is by itself anti-inflammatory, because everything in the hospital, everything in BioCare Hospital goes in that direction. We're going to watch what you eat, what you drink, what you do. We're going to do hyperbaric oxygen and other oxidative therapies. We're going to be doing ozone. We're going to be taking care of you in every possible way. And one very important part, because the huge part of the immune system is based on your intestinal tract, is going to be the care and the enhancement of your intestinal flora population. But you have to do it in a hospital, because you're going to be supplemented with intravenous nutrition. You're going to be helped with rectal implantation of the good flora that you're going to need, because we need results right away, because we want you to be helped right away, because I want you to feel the benefit of being at BioCare very soon. I want you to realize that your body is very resilient and that the body can resist disease. We tend to think that when we have a disease, that the medicine, the doctor, that type of thing is everything we need. But that is part of the truth. In other words, when you take any given disease, whatever it is, you are given a prescription, you're given a medication, you're given a procedure. But that should only be to help and support what your body can do for you. Because we frequently forget that our bodies are very active, that our bodies always try to go to health, that our bodies will always try to heal and mend and correct the problem. And many times all our bodies need is the chance, the opportunity to do what the body can. But if we don't feed it correctly, if we don't have the supplies the body needs, we cannot win that war. When you have a cancer, your body is at war. Your body is fighting against the disease. And I could say a lot about the same thing with heart disease, with vascular disease, with all these things. You're going to be getting results in few days instead of long time. I talk to many people and they tell me, doctor, I have this, what can I do? And I always say, the first I need is that you come with your pajamas. Why? Because I want you in the BioCare environment. I want to control your 24-hour. I want to control your 7 days week. I want to be working with you day and night, very gently, but very thoroughly, in order to let your body create the environment to heal, to manage the disease. You have to understand that every time we have a disease of any kind, it has a tremendous cost to the body. Our bodies lose a lot of energy, lose a lot of nutrients, lose a lot of things that we don't replace. We just give it a prescription. Even if you have a flu, you take an antibiotic. What are you doing for your body? In the old times, we did a lot more. They would give you a chicken soup and lots of water. They were a lot more careful. Bed rest. Where is bed rest in the medical world nowadays? It doesn't exist anymore. But it's very important that we take care of the body. We protect the body. We create a cocoon in which we're going to work with that body and we're going to feed it and we're going to get it to the point where the body can fight back, face off the disease that's affecting the body. But for that, you need the supplies. When you go to war, I mean, the bombs is one thing you see, but there's so many things behind it. There's transportation, there's fuel, there's logistics. Just think of food for the soldiers. How many people are in a war? They have breakfast, lunch, and dinner. I don't know how they do it, but they have to do it because if your soldiers die, you lost the war. In your body is what your white blood cells. We have to support your white blood cells because they're fighting the war. They're our soldiers. You want them strong, capable. And the only thing we can do it is by taking care of the whole body. The body knows how. The body really knows how to fight back, but needs the chance. It got sick in the first place because we were doing things wrong. But now we have to correct them, and we have to correct them rapidly. So believe me, disease management at BioCare Hospital can be very different and can be very rewarding in terms of outcome. And you can go to our website, you can go to our YouTube channel. There are many people that will be very happy to share their experience at BioCare with you. So you don't have to take it from me. You can take from people that came to the hospital, from people that went through a problem, from people that saw how the problem was solved, and they were very happy. And a very frequent phrase I listen from my patients is, I wish I would have known before. So don't wait. Learn about it. Once again, preparedness is unshakable. We have to be prepared. And you have to say, what am I going to do if I ever get sick? What am I going to do if I ever get what's called a deadly disease like cancer or a heart attack or a stroke? What am I going to do? Because the better prepared you are, the more you know your options, the more you know the way you're going to take, the more chances you have of responding very rapidly to the challenge and be more successful. So do it for yourself. Start thinking of all these ideas. Take care of your body. Watch it. Really be proactive about it. Watch it. Have a commitment to keep your body in good shape. Offer your body a vacation. But a vacation in a health getaway, in a cocoon that's going to improve all your capacities. And if it ever gets sick, then think of what you really like to do with that body of yours to meet the challenge. That is what I offer you at BioCare. So click, call, a call is free, an email is free. Just think of us as friends and allies. Till next time, I'm Dr. Rodrigo Rodriguez with BioCare Hospital.